third wave of COVID-19 pandemic may be inevitable if in Nigeria due to our attitude to safety protocols. The federal government has expressed worry over rising number of absconding quarantine passengers at Nigeria's entry points. The Minister of Health, Osage Ihanire, noted that the actions of the defaulters portend danger for public health safety, warning that travelers found ignoring COVID-19 safety measures will face sanctions. You know, this is strange. We're not able to control the people that are entering our country, and we're not able to even provide those measures that they are taking in other African countries and some other countries. We were told about the Rwanda experience, and there's no big deal to this thing. And
it's just the will. It's just the will. The will to enforce these biosafety measures has to be there. I don't know why this sort of things are happening in my country. I've spoken at length about how in Rwanda they were able to ensure that foreigners do not come into their country and simply escape from the airport. No.
The corner
you cannot escape it. You can't.
There's a
even the person who, when you get to the airport, when you land at the airport, it's not just any driver that will come and pick you. They are designated. You can't choose your own. You can't choose even an hotel that you want to stay. You are not going to choose an hotel. You are a visitor to their country. They have designated hotels. If you want, if you are a tourist, you want to visit certain places of interest, they determine the places that you can go, because they want to be in complete control. They want to be able to ensure that you do not get out of line. So, and once they pick you from the airport, you are going straight to do a test. You will not be able to leave that hotel until the result is out. You can't go anywhere until the result is out. That way they were able to bring down, because at a point it looked like they were losing it. That way they were able to bring the situation under check, and it still looks like Africa's most promising country till today because of some of these measures. We cannot, when I heard from the Lagos governor that about 18% of travelers coming into Lagos cannot be accounted for, I said, what's going on? Why would people escape quarantine?
Down fake addresses?
Yeah, some of them, even to their phone numbers that they dropped were fake, just so that you won't be able to track them. And a lot of them are coming from high incidence countries like Brazil, like Turkey, and even South Africa. That's wicked. Yes, of course, that's wicked. You are coming from India and you don't want to quarantine? Our system is too loose. It allows for people to get away with blue murder, and we have to sit down and tell ourselves that enough is enough. Because, as I've said repeatedly, we have no other means by which we can check the spread of this thing but by obeying those biosafety protocols. If we don't do that, we do not have the infrastructure to support us in the event of a breakout. And we are seeing incrementally, you are seeing that this thing is around. I think we moved to 500 or so a couple of days back. That's the first time in many months that we've gone that high. That should alert us to the need to get very serious about this.
Well, we seem not to be taking this as serious as we took the first and second wave. I don't know. Are people tired of what's happening? And this thing is claiming more lives.
Yeah. Ayo, you know my experience with COVID-19. So I wear the nose mask anytime I'm stepping out of my door. And I look at people as I go about. these days I hardly see anybody wearing the mask.
Yes, even public places.
Now, let me take you back to the Liberian Sawyer who came to Nigeria with Ebola. How our system assisted him to escape from the airport. Luckily, they took him to a private hospital where he met Ameyo Adadevo, who was quickly able to diagnose and insist that he was going to go away. She had to physically hold him and ensured, and unfortunately, in the process, you two got it. So what I'm trying to say is that in this country, there are no consequences for anything. Just as
and even foreigners are aware of that.
Yes, there are no consequences as long as you. Haven't you heard that people are even obtaining fake
COVID-19?
No, PCR test. This PCR test.
It's like I think Bassi and company say it's a matter of cash or something like that. So that we compromise so much, and we don't even think about the implications. See, when people talk about rule of law, they don't seem to understand that when you have rule of law and you obey the law, it is in the interest of everybody. Otherwise, you run into anarchy. This is anarchy right there that we are caught in. And this Delta variant, they say is faster in spreading and is deadlier.
Yeah, of course.
And we don't seem to even care. I remember somebody was making fun of me the other day. I was on Allen Avenue. I think I told you once on this. And he was looking at me. He was like, have you COVID don't return? And I actually looked around. I saw that it was just about 2 or 3 of us in that entire Allen about area. I went to buy a newspaper that had everybody, nobody else was wearing the thing. So I was the guilty party now. I was the wrong one now.
You now felt strange.
I now felt strange. Whereas they should commend me.
Yes.
But rather, I was now the odd man out. And that is the problem we have.
I think even the enlightenment that is meant to bring us back to how we used to protect ourselves, it's just not there.
I think it has petered down. We need to up it a little bit more.
Because when you look at the outbreak, countries like India, countries that they have better health facilities.
Yes.
Than Nigeria.
Turkey.
South Africa.
Brazil.
God forbid, if we are faced with this situation, we might not be able to handle it.
No, we won't be able to handle it. If it gets to the level of Turkey, let's not even talk about India. If it gets to the level of South Africa, we'll be in serious trouble because we don't have enough health facilities, very few bed spaces. I talked about Abuja, and we don't even have enough oxygen because this particular variant is said to be very reliant on oxygen. You use oxygen more if you are infected by this one. And look, the president just asked for more money. The environment that is sought for the other day, part of the money is meant to build an oxygen plant. The more than 800 billion that he asked for. Part of it is meant to build an oxygen plant. Late last year, around December, over a period of 3 days or so, Abuja, the hospitals in Abuja, including the COVID-19 isolation center there, ran out of oxygen. And people died, including VIPs. Over that period, like 18, 19, 20 of December, so people died because they ran out of oxygen. Now you can imagine what will happen if it were to be a big outbreak. Where are you going to? And for the poor people, our poor people need to engage their brains more. Because when, due to your own carelessness, you get infected, and we don't have enough bed spaces. All of the bed spaces they have in the Abuja area, with its population of about 2 million, is now up to 30,000. For an area where you have about 2 million people. So can they cope?
As crisis.
Can they cope with a big outbreak in that area? The answer is no. So the poor man should know that if a senator is infected and both of them are in the isolation center, and both of them need oxygen,
They'll give,
and the oxygen is enough for one, nobody will. They will give the big man first. That's the way it is. So what the poor man needs to do is to protect himself, ensure that he doesn't get infected. But to simply be going around like all of the stories are false, because till today there are still some individuals who say no, there's no COVID. No COVID.
So you can just imagine that people watch BBC, watch CNN, watch international stations and see people dying, but still that conclusion is that is another way for government to siphon money, that there's no COVID in Nigeria.
I told you that a professor, after I was in isolation center, and I decided to write about it in my column so that people know that this thing is real. A professor, he said, I know you are pulling stunt. I know you probably went to do investigative journalism. And I said, to go
inside the isolation center,
I said, to go and expose myself to that kind of place. I said, no, sir. I went there because I had no choice anyway. I had to be there. And I said, so if we have skeptics, even among the rank of professors, that tells you where we are.
I have joining us a renowned virologist and the World Health Organization consultant, Professor Iwole Tomori. He joins us via Zoom. Thank you for staying with us.
Good afternoon.
Good afternoon, Prof.
My name is Oyewale Tomori.
Okay, Iwole Tomori, sorry.
Thank you.
How would you describe our response to the Delta variant of COVID-19?
Very appalling, very distressing, very annoying, and I don't know how to describe it. I think we're looking for trouble and we're not ready for it yet. I can give you a few data which I've been working on. Okay. In the month of June, we had 1,500 cases. For now, up to the end of July, which was minus today's date, the number has shot up to 8,000. From 1,500 to 8,000 in the month of July. One of the things that is worrying me is that the number of incoming passengers and the number of outbound passengers, the numbers of those positive are also increasing, which is telling us that, I heard you discussing about what Rwanda was doing. I think something is wrong with us in this country. I'm sorry to say that. We know where the danger is, but I also had my friend saying he looked like the odd man out when he wears his mask. You're not the only one. I do the same thing, but I keep telling everybody, if you're entering the lift with me, if you're going, please wear your mask. And if I'm going to a shop and I know this thing, I'll get out and don't buy anything from them. I think each of us have to handle this thing on our own personal level. The problem is here, and we are having it. And then government is not giving us the kind of information. We're not analyzing our data the way we should analyze it to let the people know there's a big danger. Shooting from 1,500 in June to 8,000 in July, something is wrong.
Now, where exactly do you place this? Because even in spite of this, we are told that at least 13 states are really not testing. So the figure could even be higher than the 8,000 that you're talking about. So who do we blame for this?
My friend, the blame comes on both sides. The government itself, I've always said it, they're not serious about some of the things they're doing. I'm sorry to use that word. Take that issue of testing people. We had advised this government many times ago that test everybody on arrival in Nigeria, instead of running after people who will not show up. When you test everybody, within a day or two, you have your result. Then you know who to follow. Instead of following all the 50,000 people that are coming to the country, test them on arrival. We suggested that to them a long time ago, but they will not listen. I've never seen a situation like this where you don't have the capability or capacity to do something, and then you put something in which you are not able to control. Test everybody on arrival. Then you know who is negative, who is positive, and you know who to follow up and reduce the problem we're having now. You mentioned Lagos State. There are many states where people who finished who came in whatever, and then and are not going back to test. And what am I saying? When those people are coming in, they are coming in with what you call negative certificates. How come they are positive? We're getting the numbers of those who are inbound passengers increasing. I mean, these figures are here, which we are showing that almost like every day, doubling the number of cases of people who are coming into this country, supposedly with negative certificates on arrival. That's how they're able to enter the plane anyway. And then you look at it, when you test the number we've tested, apart from those who are escaping, the number is increasing, the percentage, the rate is increasing, and almost like doubling every week. So what are we doing?
Does it then suggest that that those people do not go through real testing before they come here, that they get to Nigeria and we discover that we test them and we discover they are positive?
No, there are possibilities. I mean, it is possible that you can be negative, the day you test. But 3-4 days later, if you're incubating the disease, may not show, may be negative.
Okay.
But within 3-4 days, if you're incubating, you should get positive. And that's waiting for 7 days, I think is the wrong thing to do. We're certainly going to miss a lot of people if we miss, or some people, if we test them on arrival. But it's not like the one we're missing now. I mean, when Lagos City is saying 80% or more, not even showing back, for testing. And you create problems for your people. How many places do we have laboratories where you are testing? If I come from Idori and I arrive in Lagos, and then you tell me, do I stay in Lagos for 7 days because there's no lab in Idori? Or do I go home and then come back? Why are we creating obstacles for our people? And that's what we're telling the government. Get everybody tested on arrival. Then it doesn't matter where I go. If I go to Idori, you can follow me up. And I know, of course, there's also the point you raise. People will give wrong figures and things. But at least you know, if you have at least your name there, and you announce your name on the radio that you are positive, come and show up. Your neighbors will bring you out, even if you give a wrong telephone number. We know the kind of people we have in this country. Why are we not getting our laws to go around all those? I mean, we can't overcome all of the tricks that our people will play. But at least the tricks, do something about those ones, rather than give this idea of come back 7 days, which is not working, and you know it's not working, and they're not doing anything about it. You said they will seize your passport, you put your name. How many passports have they seized? How many of them? Who is traveling anyway? Who needs their passport to get out? If I come back from this country, do I need the passport to go for any part to anyway? You tell me to go for self-isolation. Who is monitoring whether I'm doing any self-isolation? See some of the barriers we're talking about. The people who arrive, they go for the barrier. People will come in and they go into the people are escaping from the so-called places you're putting them. What type of country is this?
So finally, Professor, what do you advise the government to do?
Well, we've advised, and we keep saying it. First of all, we as individuals, we have a role to play. We have to be responsible. Because like I said, it's not the government that is going to get COVID. It's me that will get COVID. Therefore, I should be taking care of my own health. I need to say wear mask because of this. Then I need to say, if people say there's no, we have seen people. I'm sorry to say, a colleague of mine died last week. A colleague of mine, the professor of virology, died last week. So don't tell me that COVID is not around. And you had it, the governor of Oyo State mourned the person. People are writing all those messages. So why are we deceiving ourselves that there's no COVID? I mean, look. So what do we do? As I said, first and foremost, you as an individual, take care of your health. I was at a meeting the other day when I was supposed to give the keynote lecture or something. From the head, the so-called high table, to the ordinary people were wearing their mask in different forms. Some had it on their neck like a neck choke, some had it only their mouth. And I said, look, I have a house cleaning job to do before I even give my lecture. All those of you here are wearing your mask in your different places, please put it on properly. That's number one. Those of you have in your pocket, take it out of your pocket and put it in your mouth. The MC was talking with his mouth open, no mask. And I said, the first cleaning thing I did, I had sanitizer, I had my handkerchief. And I wiped the microphone. I said, ideally, if I had my way, I would dip this microphone into a bucket of detergent. Because the guy was talking and speaking on those things. Those are things you should be standing for your own life, for everybody. We must take responsibility for our life. If you see anybody who is sitting by your side, is not wearing a mask, tell him to wear his mask or let him get out of your place. And if you put a signboard saying no mask, no entry, then make sure nobody enters. We have a role to play. Government can't do all that for us. And the government itself must be out there when give out the truth to every people. How many people are you testing? How many people are positive? Get that message to our people. Let them know what the problem is. I've just told you now, just simple analysis of the data, 8,000 positive in July compared to 1.5 in 1,500 in June. Are we not seeing problem? Is it not coming around with us? And our colleagues in the and other places are finding out a large percentage of these cases are because of the Delta variant. These are the kind of messages we should get out to our people.
Prof, sir, I know that in the past you and I we've exchanged private chats on WhatsApp on this issue. Even I think still yesterday you still sent me something. I'm looking at I think correct me if I'm wrong. I think you are today Nigeria's leading virologist. That's what I think.
No, I don't. There are greater virologists than myself. So maybe I'm the oldest.
Okay.
That's what you say.
All right. Yes. So
there are younger ones who are smarter than myself.
Yes. Okay. My thinking is this: do structures on ground? Do we have the structures? It's okay. We are talking about louding it, making people to be aware of the dangers of COVID-19 and the rest of them. Do we have the structures actually to deal with this thing? Especially one, because of the Delta variant that seems to be coming, which is deadlier and faster in acting and spreading. And then the fact that we do not even have facilities. I've listened to the Minister of Health talking about maybe there's going to be some MOUs or discussions about having a vaccine production center in Nigeria. Do we have the structures to deal with this thing in terms of vaccination? Especially when you also have anti-vaxxers also in this country. We have anti-vaxxers, we are one, and then two, do we have the structures?
Mr. Shida, yeah. Let's just
allow Prof. Or you want somebody else to answer?
It's for you, sir.
Okay, thank you very much. First of all, let me tell you, we are never making use of the structures we have on ground properly because of internal competition, unhealthy competition among the different kind of researchers, among the states and everybody. In a national emergency like this, NCDC should have absolute control over the laboratory testing in this country, but that's not the case. What do they call the thing about health being on concurrent list? He has no control over what the states are doing. States are doing what they like. Yes. You remember Kogi, you remember a few others. Up in the north, many of them are not testing. But NCDC has nothing to, it has no power to do anything about that. That's the first problem. This is a national emergency, and that we should get NCDC to be in charge of the structure and the facilities we have. The ones we have, but not making full use of them. Secondly, internal relationship between us as scientists and something. But there's no reason in other parts of the world, the testing of samples, you have 1 or 2, 3 centers that are testing. South Africa has only about 4 laboratories, but there's this collaboration. Each state, they know where to send their samples to. In Nigeria, we don't know that. Everything is controlled from the center that has no control over anything. And that's the problem we're having. And so, for example, we have a center in India, we have in Abuja, and we have in a few other places. No, there's no coordination, there's no collaboration on how to get these samples. The important thing about sequencing, it is not telling me that you found the Delta 2 months ago, or a sample that arrived 2 months ago, and you're now telling me now, as it's arriving, your testing should be catching it. And that's the only way you can quickly do a contact tracing and make sure that it doesn't spread beyond your limit. If somebody comes into Nigeria, a traveler comes in Nigeria in end of early June, and you're now telling me in August that it was a Delta case, where do I know he has gone to the last 2 months? Was he in isolation when he came? These are issues that's why they're organizing that testing, or what we call real-time testing. If this person arrives today, you can get the result out today. And that's why we suggested get these people tested on arrival. Yes. The facilities are there if we make use of it. It's just a matter of coordination.
My
now back to vaccine.
Unfortunately, we can accommodate more questions. I want to thank you, Professor Oyewale Tomori. Thank you. That's a renowned virologist and World Health Organization consultant. Thank you so much for your contribution.
It's my pleasure.
I'd like to thank you too for your contribution today.
Thank you very much.
Thank you. And BQ, thank you for yet another Sunday special of Journalist Hangout.
Thank you.